What is type 1 diabetes? Diabetes mellitus type 1 is a chronic disorder caused by the pancreas not secreting the hormone insulin or secreting it in small concentrations, where the importance of the hormone lies in enhancing the ability of glucose to enter the cells and produce energy. Type 1 diabetes causes an increase in the level of glucose in the blood, English, hyperglycemia. Therefore, the patient needs daily insulin injections to maintain blood glucose levels, and although the first type of diabetes is common in childhood or adolescence, it may also affect adults. What is the role of insulin? Insulin is a hormone that comes from a gland in the pancreas, and the pancreas secretes insulin into the bloodstream, allowing sugar to enter the cells. Thus insulin reduces the amount of sugar in the bloodstream, as well as insulin secretion from the pancreas. What is the role of glucose? Glucose or sugar is the main source of energy for the cells that form muscles and other tissues, and glucose has two main sources, namely food and liver stores, as sugar is absorbed from the bloodstream, enters the cells with the help of insulin, and the liver stores excess glucose in the form of glycogen. When glucose levels are low, in cases of prolonged non-eating such as fasting, the liver breaks down stored glycogen, converting it into glucose to keep blood sugar levels within the normal range. What is the difference between type 1 and type 2 diabetes? Although there are some common factors in type 1 and 2 diabetes, they differ in many other factors, such as causes, methods of treatment. Many may wonder which is the most dangerous type I or 2 diabetes, but both types are dangerous, as high blood sugar leads to serious health complications. One of the most important differences between diabetes 1 and 2 is the process of insulin secretion. In grade 1 diabetes, the pancreas does not function to secrete insulin as a result of the body attacking and destroying pancreatic cells. In type 2 diabetes, the pancreas secretes insulin, but in small quantities and not enough for the body's need, or the cells do not respond to insulin properly. As the disease progresses, it is possible that the pancreas will completely stop secreting insulin. As for the difference between the symptoms of type 1 and 2 diabetes, they do not differ from each other. But in the first type of diabetes the symptoms appear faster, unlike the second type, whose symptoms appear slowly. Unlike type 2 diabetes, type 1 diabetes patients do not suffer from obesity. In the treatment, the difference between type 1 and type 2 diabetes is that the first type depends on insulin only, while the second type is treated by various pharmacological and non-pharmacological methods, and insulin may be used in some cases. Causes of type 1 diabetes. Type 1 diabetes occurs due to the destruction of the immune system beta cells located in the pancreas and responsible for the secretion of insulin, as insulin secretion becomes little or no, and the main factor for the development of type 1 diabetes is unknown. It is worth noting the possibility of some people developing so-called secondary diabetes, which is similar to the first type, but the cause of the death of beta cells in the pancreas is a disease of the pancreas, which causes the destruction of beta cells. Risk factors for developing type 1 diabetes. The incidence of type 1 diabetes may be associated with genetic factors and some environmental factors, such as exposure to certain types of viral infections, such as mumps, rubella, and enterovirus. Type 1 diabetes is an immune disease that may result from a viral infection, because the body produces some antibodies to fight the virus, but they attack normal body cells similar to the virus. Exposure to certain toxic chemicals. Drinking cow's milk in childhood. The incidence of upper respiratory tract infection at an early stage of life, and the likelihood of developing diabetes 1 is higher if infected in the first 6 months of birth. Type 1 diabetes is more common in males than females. Symptoms of type 1 diabetes. Signs and symptoms of type 1 diabetes appear gradually or suddenly as follows. Frequency of urination. Excessive thirst. Rapid weight loss. Exhaustion. Excessive appetite. Nausea. Clouding of vision. Delayed wound healing. Dry mouth. Frequent inflammation of the skin, urinary tract, or female vagina. Mood swings. Involuntary nocturnal urination of children. As for the emergency symptoms of the first diabetic, having convulsions. Quick breathing. The patient's breath smells like fruit or acetone. Abdominal pain. Loss of consciousness. How is type 1 diabetes diagnosed? The diagnosis of type 1 diabetes is based on a number of laboratory tests, including laboratory test for glycated hemoglobin, HbA1c, which rises above 6.5 when developing diabetes. Laboratory examination of random glucose, diagnoses diabetes with a height of more than 200 mg per deciliter. Laboratory examination of fasting glucose, and diabetes is diagnosed with a height of more than 126 mg per deciliter. Oral glucose tolerance test, which reveals the concentration of glucose 2 hours after ingestion of a sugary solution, and diabetes is diagnosed with a glucose concentration above 200 mg per deciliter. Tips for living with type 1 diabetes. Here are some important tips for living with type 1 diabetes. Periodic monitoring of the blood glucose level through the examination of glycated hemoglobin, and at a rate of 4-6 times a year, to ensure the efficiency of the treatment recommended by the doctor. Adherence to the diet for patients with type 1 diabetes recommended by a doctor or clinical nutritionist, which is with the aim of maintain blood sugar levels throughout the day within normal limits. Instruct the patient to move away from the idea of starving the body or satisfying it. Realizing that starvation of the body leads to a decrease in blood sugar levels, which has complications that, if repeated, can be dangerous. Knowing that saturating the body with sugars and starches, in turn, leads to high blood sugar levels, feeling very tired, stomach tingling, and other symptoms. Maintain healthy teeth and clean them continuously to avoid chronic gum infections. Control the level of cholesterol in the blood pressure within normal rates. Exercise regularly. Quit smoking. Pay attention to the symptoms of low blood sugar, such as rapid heartbeat, sweating, trembling hands.